Oral surgery terminology made easy. Patient-friendly. Abscess. What it means. A pocket of pus caused by an infection. Explanation. This can form in your gums, teeth, or jawbone due to bacteria from decay or injury. Surgery may be needed to drain it and remove the infection to prevent pain or spread. Allograft. What it means. Bone or tissue from a donor used in surgery. Explanation. In bone grafting, donor bone from a tissue bank may be used to rebuild your jaw instead of taking bone from your own body. It's safe and tested for quality. Alveolar bone. What it means. The part of your jawbone that holds your teeth. Explanation. This bone supports your teeth and can weaken if teeth are lost. Bone grafting or implants often involve working with the alveolar bone. Alveoloplasty. What it means. Smoothing or reshaping the jawbone. Explanation. Done after tooth extraction or to prepare for dentures, the surgeon smooths sharp or uneven bone edges in the jaw to ensure a comfortable fit for dentures or proper healing. Anesthesia. What it means. Medicine used to prevent pain during surgery. Explanation. Anesthesia can numb a small area, local anesthesia, like a shot to make your gums numb, or make you sleepy or fully unconscious, sedation or general anesthesia. Ankylosis. What it means. When a tooth fuses to the jawbone and can't move. Explanation. This can happen with impacted teeth or after trauma. Surgery may be needed to remove the tooth or correct jaw function. Apicectomy. What it means. Surgery to remove the tip of a tooth's root. Explanation. Done when a root canal doesn't fully clear an infection. The surgeon accesses the root through the gum, removes the infected tip, and seals it. Biopsy. What it means. Taking a small piece of tissue to check for problems. Explanation. If there's a suspicious lump, sore, or growth in your mouth, the surgeon removes a tiny sample and sends it to a lab to check for issues like cancer or other conditions. Bone grafting. What it means. Adding bone to your jaw to make it stronger. Explanation. If your jawbone is too weak or thin due to tooth loss or gum disease, bone material is added to support implants or other treatments. Choroidectomy. What it means. Removing only the top part, crown, of a tooth, leaving the roots. Explanation. Often done for impacted wisdom teeth near nerves to avoid nerve damage. The roots are left in place if they're not causing problems. Crown. What it means. A cap that looks like a tooth placed over a damaged tooth or implant. It restores the shape, function, and look of a tooth. Crowns are often used after implants or to protect a weak tooth. Curettage. What it means. Scraping out tissue or debris from a socket or bone. Explanation. Often done after tooth extraction or during gum disease treatment to clean out infection or damaged tissue from the gums or bone. Cyst. What it means. A fluid-filled sac that can form in the jaw or gums. Explanation. Cysts can develop from infections or impacted teeth and may cause swelling or damage to nearby teeth or bone. Debridement. What it means. Cleaning out damaged or infected tissue from a wound or surgical site. Explanation. During oral surgery, the surgeon removes dead tissue, debris, or infection from the gums or bone to promote healing. Dental implant. What it means: an artificial tooth root placed in your jaw to hold a replacement tooth. Explanation: it's a metal post, usually titanium, that acts like a natural tooth root. A fake tooth, a crown, is attached to it to fill a gap from a missing tooth. Dry socket. What it means: a painful condition after tooth extraction when the blood clot in the socket is lost. Explanation: after a tooth is pulled, a clot forms to protect the socket. If it dislodges, the bone and nerves are exposed, causing pain. Exostosis. What it means: extra bone growth in the jaw. Explanation: similar to a torus, these are benign bony bumps that may need surgical removal if they interfere with dentures or cause discomfort. Extraction. What it means: removing a tooth from your mouth. Explanation: this happens when a tooth is too damaged, decayed, or causing problems like a wisdom tooth. Flap surgery. What it means: lifting the gum to clean or treat the area underneath. Explanation: used for severe gum disease, the surgeon pulls back the gum to clean infection or damaged tissue from the tooth roots or bone. Frenum. What it means: a small band of tissue in your mouth, like under your tongue or between your lips and gums. Explanation: if it's too tight or thick, it can cause issues like speech problems or tooth gaps. Gingiva. What it means: your gums. Explanation: the soft tissue around your teeth that holds them in place. Guided tissue regeneration. What it means: encouraging new bone or gum growth with special materials. Explanation: used in gum disease treatment, a membrane is placed to guide the growth of new tissue and bone. Hemisection. What it means: removing half of a multi-rooted tooth. Explanation: for a molar with infection or damage in one root, the surgeon removes the bad part and keeps the healthy part. Impacted tooth. What it means: a tooth that's stuck and can't come through the gum properly. Explanation: often refers to wisdom teeth that are trapped in the jaw or under the gum. Incision. What it means: a small cut made in the gum or tissue. Explanation: surgeons make incisions to access teeth, bone, or infected areas. Marsupialization. What it means: creating an opening in a cyst to drain it and prevent regrowth. Explanation: for large cysts in the jaw, the surgeon makes a small opening to drain the fluid. Maxillofacial. What it means: related to the face, jaws, and mouth. Explanation: oral and maxillofacial surgeons handle surgeries involving these areas. Occlusion. What it means: how your upper and lower teeth fit together when you bite. A poor occlusion, a bad bite, may require jaw surgery or orthodontic work. Orthognathic surgery. What it means: surgery to fix the alignment of your jaw. Explanation: used for severe bite problems like overbite or underbite, jaw pain, or breathing issues. Osseointegration. What it means: the process of a dental implant fusing with your jawbone. Explanation: after an implant is placed, your bone grows around it over months. Osteonecrosis. What it means: Death of bone tissue due to lack of blood supply. Explanation: this can happen in the jaw, often linked to certain medications or radiation therapy. Osteotomy. What it means: cutting or reshaping bone. Explanation: in oral surgery, this might happen during jaw surgery or to remove a tooth stuck in the bone. Periodontal. What it means: related to the gums and bone around your teeth. Explanation: periodontal issues like gum disease may require surgery. Platelet-rich plasma, PRP. What it means: using your own blood to help healing. Explanation: blood is taken, processed to concentrate healing cells, platelets, and placed in the surgery site. Ridge augmentation. What it means: rebuilding the shape of your jawbone. Explanation: if your jawbone shrinks after tooth loss, bone or tissue is added to restore its shape. Sedation. What it means: medicine to help you relax or sleep during surgery. Explanation: options include mild sedation, you're awake but calm; moderate sedation, you're drowsy; or general anesthesia, you're fully asleep. Sinus lift. What it means: adding bone to the upper jaw near your sinuses. Explanation: if you need implants in your upper back jaw but lack enough bone, bone material is added, soft tissue graft. What it means: moving gum tissue to cover exposed tooth roots or improve gum health. Explanation: if your gums recede, pull back, tissue is taken from another part of your mouth. Splint. What it means: a device or material used to stabilize teeth or bones. Explanation: after jaw surgery or trauma, a splint, like a brace or wire, holds teeth or bones in place. Suture. What it means: stitches used to close a cut in your gums. Explanation: after surgery, stitches help the gum heal by closing the wound. TMJ. Temporomandibular joint. What it means: the joint connecting your jaw to your skull. Explanation: problems with this joint, like pain, clicking, or locking, are called TMJ disorders. Torus, or tori. What it means: a bony growth in your mouth. Explanation: these harmless bumps can grow on your jaw, under the tongue, or on the palate. Vestibulostomy. What it means: surgery to reshape the gums or mouth to prepare for dentures. Explanation: if the gums or mouth shape makes dentures uncomfortable, this procedure adjusts the tissue.